Hi everyone, welcome to my Optimum How God's Way YouTube channel. Today we are going to look at how to take care of our oral health naturally. Gum disease, also known as periodontal disease, is a very common condition affecting nearly half of all the adults over 30, ranging from gingivitis, which is mild gum disease, to periodontitis, which is severe gum disease, leading to tooth loss if left untreated. In the United States, around 47% of adults over 30 and 70% of adults over 65 are affected by gum disease. Globally, severe periodontal or gum diseases are estimated to affect over 1 million people worldwide. Periodontal or gum disease is a major cause of tooth loss. In my case, after 10 years of not bothering to go for a dental checkup, the last time I went about 2 years ago, I was told that I had periodontitis, severe gum disease, and tooth problems like loose teeth, and 7 of my teeth would have to be extracted. That means to put partials in. That would cost me $16,000. But remember, God created the whole body, including gum and teeth, that heals itself, provided we give all the needs of the cells in the body. So I started on a quest to treat my problem naturally. Now let's look at signs and symptoms of gum disease and teeth problems. Number 1, early signs often associated with gingivitis or mild gum disease would be like bleeding when you brush or floss, and your gum would be red, swollen, tender, and halitosis or persistent bad breath, a sign of bacterial buildup or bad taste in the mouth due to the bacterial buildup, or more advanced signs like often associated with periodontitis, severe gum disease. So you would see like gum recession or pulling away of your gum from the teeth, exposing more of the tooth surface, and you would have some loose or shift teeth as the supporting bone tissues are damaged, causing your teeth to be loose or shifting, and spaces developing between teeth due to gum recession and bone loss, and pus between teeth and gum due to infections and advanced gum disease, and painful while chewing, inflammation of gum, and bone loss. And you would feel changes in how the teeth fit together when you bite. Others like plaque, tartar, toothache, sores, ulcers in the mouth, sensitive teeth when you drink either hot or cold drinks, and discoloration like white, brown, black, yellow, and cavities like holes in the teeth, and your teeth would appear longer due to gum recession, and you would lose teeth, or foul taste and foul smell, and pain when you are biting or anything. Now let's look at poor oral hygiene that contributes to other various diseases. Number 1, cardiovascular. Oral bacteria would travel and enter the bloodstream to the heart, contributing to hardening of arteries, increases the risk of heart disease and stroke. Gum disease would cause inflammation and blood clots, high blood pressure, atherosclerosis, endocarditis, and heart attack and stroke. 2, diabetes. Periodontal disease can negatively impact blood sugar control. With diabetes, may increase the risk of diabetes. 3, respiratory infection. Bacteria from the mouth can be inhaled into the lungs, and it could cause pneumonia, bronchitis, COPD. 4, dementia. Studies suggest a link between increased risk of dementia, including Alzheimer's, and poor oral hygiene, or oral bacteria can travel to the brain, contributes to cognitive decline. 5, pregnancy complication. Bacteria due to gum disease could lead to complications in the pregnancy like premature birth, low birth weight in babies. 6, cancer. There is a connection between gum disease and increased risk of oral cancer and other cancers. 7, autoimmune diseases. Bacteria from the gum disease can cause the developing and or worsening of some autoimmune diseases with chronic inflammation like lupus, rheumatoid arthritis, by triggering and exacerbating symptoms, by increasing inflammation or oral microbiome imbalance, or the same bacteria that cause gum disease may also trigger inflammation in the joints. 8. Kidney disease. Bacteria from gum disease could travel and enter bloodstream, could cause inflammation or infection in the kidneys. 9. Infertility or erectile dysfunction. Gum disease would cause men to have reduced sperm quality or motility in the production and the function of the sperms. In women, it would cause women to take longer time to get pregnant. 10. Osteoporosis. Poor oral hygiene or gum disease can increase the risk of bone loss and disease or exacerbate the effects of osteoporosis. 11. Other infections like oral thrush, fungal infection, candida, yeast infection, mouth sore. And poor oral hygiene allows the buildup of plaque and bacteria that creates favorable environment for candida to thrive in the mouth. Now let's look at effective method of healing. In order to heal any sickness, illness, or disease, first of all, we need to find out or ascertain the cause or causes. Secondly, we need to remove, change, and correct anything and everything that causes, and we need to expel impurities, toxins, and waste. Lastly, we need to re-establish the right health principles. Let's look at the first effective method of healing. Ascertain or find out the cause or causes. 1. Not chewing your food well. When we chew our food well, saliva produces an enzyme called amylase, which is very good for teeth and gum, and that amylase breaks down starches into food and plays an important role in overall oral health, like washing or rinsing away food debris and neutralizes acids produced by bacteria or food or drinks to maintain a neutral pH in the body, to protect the teeth from erosion and gum from getting infected, to deliver minerals, nutrients to the teeth and gum. 2. Tobacco, chewing, alcohol, drinking, cigarette smoking, and even caffeine and sugar could cause gum disease and tooth problems. Like caffeine, sugar, and alcohol can dry out the mouth, so you have less saliva, so less production of amylase, means more bacteria and plaque buildup on teeth, cause tooth decay, gum disease, and oral cancer. And smoking impairs blood flow to the gum to increase the risk of gum disease. Poor oral hygiene. 4. Bacterial plaque. A sticky, colorless film of bacteria constantly forming in the mouth, later turn into tartar that would harden because the bacteria will form a film to protect themselves. 5. Diabetes. If you have diabetes, you are more susceptible to infections. 6. Genetics. When you inherited wrong or harmful or unhealthy diet, lifestyle, or habit, you inherited the same kind of weakened genes already that could cause gum and teeth problems. 7. Hormonal changes like pregnancy, puberty, menstruation, menopause. Yes, those hormonal fluctuations and significantly impact oral health and cause you to have increased susceptibility to gum disease and other dental issues. 8. Medications. Antidepressants, high blood pressure medication, heart medication, decongestants, or antihistamine could cause you to have dry mouth, swelling gum, tooth decay, and gum disease. 9. Others like diet, sugary, refined, carbohydrate diet, too much acidic diet, or dehydration would cause less saliva, less production of amylase. Or age, as we get older, our teeth and gum get weak. Or stress, or pre-existing disease or disorder that affects the entire body. Or autoimmune diseases like lupus, rheumatoid arthritis, cancer, HIV or AIDS, and teeth grinding. Now let's look at second effective method of healing: to remove, correct, or change anything or everything that causes causes decay or gum disease, be it diet, habit, or lifestyle. Third effective method of healing is to expel impurities, toxins, and waste. Although there are a lot of detox programs, I would like to share with you a simple and effective method. You have to do this detox for 3 days, and on those 3 days, eat only watermelon, cantaloupe, or honeydew, or some cleansing vegetable juice. Intake no enema intestinal bowel cleanser a night before each enema. Natural laxatives like senna, psyllium husk, slippery elms, or any other natural laxative. For the solution for your enema, take a good sized bulb of garlic, peel and blend it with 2 cups of distilled water, and squeeze a lemon or 2 and add the juice of the lemon to the water and garlic solution. Strain it and use about 8 ounces of the solution for each enema, once in the morning, in the afternoon, and in the evening for 3 days. The last effective method of healing, re-establishing the right health principles. There are 8 of them, and they promote good health, means good blood and good circulation. Number 1, godly trust. In Exodus 15:26, God says, I am the Lord that heals you. And in Psalms 103 verse 3, God heals all diseases. We just ask and allow God to heal us and obey His health principles like we obey doctor's orders. 2, open fresh air. Oxygen in open fresh air accelerates healing. Negative ions in the open fresh air helps boost immune system, and open fresh air helps improve circulation, helps provide the needs of the cells. Deep breathing helps reduce anxiety, helps speed healing. 3, daily exercise helps improve blood flow, helps boost immune system, helps reduce stress, helps reduce inflammation, helps promote saliva production necessary for production of enzyme that is good for both teeth and gum, helps create more favorable environment for healthy teeth and gum. 4, sunshine. Vitamin D helps teeth and bone get stronger and helps with the absorption of calcium, and sunshine helps boost immune system, so healthier gums and teeth. 5, proper sleep or rest. It is very crucial to have adequate sleep. Maintain your healthy teeth and gum, to allow the teeth to repair, heal, regenerate, because during sleep there is repairing, healing, and regeneration occurs. And enough sleep strengthens immune system to fight off infections, to reduce inflammation, to help regulate saliva. So sleep is a simple but powerful way to support overall oral health, to strengthen your body's natural defenses against dental and gum problems. 6, lots of water. When we drink enough water, helps with saliva production and blood. Both of them are very good for teeth and gum. When we drink enough water, it helps stimulate saliva production, which is natural defense against decay, and to rinse away food particles and bacteria, and to neutralize acids produced by bacterial food or the drinks, and to remineralize tooth enamel, less prone to inflammation and infection of the gum. And saliva helps deliver essential minerals like calcium, phosphate, and salt to your teeth. 7, always temperate. By practicing temperance, you avoid anything unhealthy, harmful, or bad, be it diet, habit, or lifestyle. You can practice to follow health principles to help maintain good oral hygiene, and by adopting a healthy lifestyle, it helps you improve your oral health as well as overall health significantly. 7, nutrition. A diet rich in certain vitamins and minerals like calcium, vitamin D, phosphorus, vitamin A, C, E, F, and magnesium, vitamin K, to strengthen your enamel, support healthy gums, and promote overall oral health, to give you healthy teeth and gums. Like apples, carrots, celery, and natural sugar cane. They are natural toothbrushes, so try to eat more of hard food like apple, carrot, celery, so that you can chew well and chew more for both the health of your teeth and gum. Omega-3 fatty acids like chia seeds, flax seeds, hemp seeds, walnuts. Vitamin C rich food like citrus, oranges, lemons, grapefruits, strawberries, kiwis, guavas, pineapples, and others. And vitamin K, spinach, natto, broccoli, kale, collard, leafy greens, turnip greens, and okra. Vitamin A like butternut, squash, carrots, apricots, pumpkin, and others. And calcium rich food, black strap molasses, lettuce, sesame, figs, bok choy, celery, chia seeds, beans, lentils, and others. Magnesium-rich avocado, nuts, spinach, seeds, legume, whole grains, leafy greens, bananas, edamame, and fig. And phosphorus, like nuts, legumes, like beans, lentils, sunflower seeds, Brazil nuts, whole grains, amaranth, and quinoa, and others. Food supplements like better than greens, spirulina, chlorella, sea moss, moringa, wheatgrass, milk thistle, and others. Now let's look at natural remedies. Number 1, chew your water and drink your food. When I was taking care of a lady about 90 years old, when you gave her water to drink, she would chew it. So if you have to chew your water, of course you have to chew even harder and more so that you can drink it. By chewing your food well, your saliva produces amylase that is very, very good for your gum and teeth. You can add a pinch of Celtic or Himalayan sea salt every time you drink your water to add minerals to your teeth. 2, good oral hygiene. Make sure you floss and brush your teeth enough, especially right after you eat, because if we keep our teeth and gum clean, so there is no food or drinks that bacteria could live and feed on. 3, oil pulling or wheatgrass pulling. For me, I like to do the oil pulling. I would put a tablespoon of coconut oil or sesame oil or olive oil, and I would swish around like gargle for about 15 to 20 minutes. Then I would brush my teeth. When I do the oil pulling, I like to add a drop or 2 of peppermint oil or oregano oil or tea tree oil. It's so refreshing and helps improve your circulation. I gargle with wheatgrass. It helps too. 4, gargle with Celtic salt after brushing your teeth for about 1 minute. 5, fasting. By fasting, you give your teeth and gum a break to heal and repair and to reduce acid exposure. It lowers the risk of cavities and decrease the inflammation in the gum, and to neutralize acids and to remineralize enamel, and to stimulate saliva production, to wash away particles, neutralizes acids, to protect against tooth decay and gum disease. However, make sure you get plenty of water during fasting. 6, avoid refined sugar, refined carbohydrates, caffeine, smoking, alcohol, tobacco, inflammation-causing food, habit, or lifestyle, or any acid-forming food. 7, liquid mineralization by Uncle Harry's natural products. You can check it out. 8, eat calcium, magnesium, phosphorus, vitamin A, C, E, F, vitamin B1, rich foods, molasses, Celtic salt, soybean, portobello mushrooms, nutritional yeast, and others. 9, make your own toothpaste. Bentonite clay, Celtic salt, egg shell powder, turmeric, neem powder, charcoal powder, ground clove, baking soda. 10, take calcium 1200 milligrams 2 times a day, magnesium 1000 milligrams 2 times a day, vitamin D 10 to 20 IUs a day, vitamin K2, zinc, vitamin B1, vitamin C, vitamin F, vitamin A. And for people who have cavities or infections in your teeth or in your gum, mix turmeric and charcoal powder. Take a cotton, put it right where the infection is, leave it overnight, and I will keep doing that until the swelling is gone. For some people, they will use cloves and ginger and garlic and make into a paste, and they use that. Friends, I would like to leave you with 3 John 2. Beloved, I pray above all things that you may prosper and be in health as your soul prosper. Bye for now. See you in my next video. God bless.